Welcome to Delta South Home Health, located in Tawasin, British Columbia. This office provides care in the clinic as well as on community visits. Home visits are reserved for bedbound clients or by exception based on the nurse's discretion. This being said, clients are encouraged to come into the clinic to promote independence. Home care services help with prevention, health restoration, and health maintenance for clients who require acute or palliative care. In assessments, environmental, psychosocial, cultural, and personal health factors affecting an individual and their family's health status are integrated in. For this reason, home health nurses must strive to be aware of all types of cultural diversity and collaborate with minorities to avoid any type of discrimination. The home health nurse provides a partnership with the client and their family to provide effective care by working on the client and the family's term. This can look like giving educational pamphlets to the client and their family and making sure that they understand them. The family plays an important part in promoting and maintaining the health of family members, as well as providing physical and emotional support. It's also important to remember that entire families are affected when members experience health issues. So an office like this, nurses usually work here, and the telephone is available for family members and clients to call in when there is a potential crisis or they're confused about their loved one's care. Here at South Delta Home Health, they use paper charting, Pixelaire, and Paris. Pixelaire is an electronic wound management system used by nurses and nurse clinicians in the community in primary care as well as long-term care sites. Documentation is done on clients' wounds, ostomies, incisions, and tube drains. There is a variety of cleaning, packing, and dressing supplies as well as wound kits available on site. This will just depend on the care plans provided on Pixelaire as well as the clients and what they need based on each appointment. Clients can either be self-referred to the clinic or home visits, or referred by a healthcare professional. During my placement, I was primarily stationed in the clinic, specifically in Clinic Room 2. And I saw clients who were mostly referred by surgeons. The clients varied in age. So nurses in this office worked closely with clients, their families, as well as the surgeons, so everyone stayed on the exact same page. As a student nurse in this clinic, I primarily did wound care on lower legs, and this just had to do with the clients coming in with that. They would come in 2 to 3 times a week, so I became quite familiar with them, and I was able to see that my care was actually effective for them. My significant learning from this placement came from, originally, my anxiety of not being able to decide what was the correct type of packing and dressing I would need for each client. It seemed very overwhelming. My nurse taught me something quite interesting. She said if I had these 4 factors, these 4 principles, I would be able to do any type of wound care on any client. She told me to be curious about the etiology. Was it from surgery? Was I able to figure out was it diabetes or a pressure ulcer? And could it be fixed? Then I need to think, is this wound healable? If it's a surgical wound or if it's a tumor. And then my care is based from if it's healable or not. My next step would be preparing the wound bed. Then finally, it'd be picking the products. So it's so much more than just caring for clients. It's picking the right products and then educating them on that. The community is so diverse, and I'm so thankful to South Delta Home Health. It was truly a pleasure to learn from these clients and nurses.